What is speech and language therapy? The main goal of speech and language therapy is helping the child communicate effectively by focusing on speech, receptive language, and expressive language issues. Do you feel that your child has some difficulty identifying familiar objects, pictures, or people? For example, when you ask him to point to certain body parts, he cannot really point to them, or when you ask him or her to point to pictures of common objects such as car, ball, some toys, or some animals? Or does your child have difficulty following simple commands such as come here, sit down, or give me that ball? Or your child does not respond when you call his or her name, and you notice that he prefers to play alone most of the time? Or your child is not using words or may have very limited words when he's already 1.5 years old? Or he doesn't use 2-word phrases when he's already 2 years old? Or you notice that your child mainly communicates using sounds and gestures most of the time. For example, like or just reaching for the object, or just showing the object to you instead of using his words. Or you notice that your child is just getting so frustrated when he can't communicate his needs or wants. These are just some of the most common observations or chief complaints made by the parents or the caregivers. So if you feel like your child is experiencing similar difficulties, or maybe for some parents, you're just unsure if your child's limited communication is cause for concern, don't worry. We, Kids in Motion, are here to help you. We are competent speech and language pathologists trained to perform screening. This is a process that helps us determine if there is a need to perform further comprehensive evaluation. If yes, we will conduct a speech and language evaluation. So what happens in an assessment? We will be using a variety of toys, books, or maybe sometimes videos to elicit a spontaneous speech and language sample. We will also observe your child's speech, receptive language, how much your child understands, expressive language, how your child communicates his needs, wants, or ideas, as well as his behavior, attention, memory, executive functioning, motor, and social skills, all in a natural context, which is through play and through conversations. We will also assess your child's oral mechanisms, structure, and function. After which, we will provide a comprehensive report that discusses your child's areas of strengths and weaknesses, his current level of functioning, the speech and language diagnosis, and some possible factors that may have contributed to the speech and language delay or disorder, the therapy prognosis and the prognosticating factors, and finally, the treatment plan or the therapy plan. We, professionals at Kids in Motion, will work as a team with your family to create a treatment journey that fits into your lifestyle, build trust, and help achieve shared outcomes. Our clinicians will collaborate with the other disciplines when necessary to ensure that the most comprehensive care is provided.